Hi guys, this is Nikki, lead vet tech with PoshDog Knee Braces, and today let's talk about post-surgical support with a knee brace and why it's a great idea. So first off, if you're planning on having surgery anytime soon, it's always a good idea to have the brace measured and started before you have surgery. So that way you've got it post-op ready to go after those sutures come out. Again, don't use it without your surgeon's knowledge until those staples or sutures are removed post-surgery. But why would you need a knee brace if you're having surgery? A big thing is stabilization and support. So stabilizing post-op means maybe less kennel time, more mobility. Again, we want to give them that first week to heal and have those sutures removed, but it might help to stabilize and give them just that extra support they need to have normal activities. Another one is pain management. Having that knee compressed and having that support and kind of giving that knee a break while we're using it is a great option, especially if you're having lateral suture. Bracing is really good for dogs that have had lateral suture, just to give that extra support they need. Reduce swelling and inflammation because we're again helping support. We're not using that knee as much and we're giving it a break, so then hopefully we'll have less fluid in there as well. We're controlling range of motion, so letting that knee have normal range of motion but keeping it in place and acting as a shock absorber can also help protect our meniscus as well. Sometimes even after surgery we can have meniscus issues, and this might help control that and prevent the issue. Muscle atrophy. Bracing post-op can help prevent muscle atrophy because we're using that leg fully instead of carrying it for 8 to 12 weeks, sometimes even up to a year. So using that leg brace post-op, that way they're using that leg and not losing muscle. And we're protecting against re-injury. So if we're using this leg, not forcing them to overcompensate, they might not need a second knee surgery or have a second knee injury down the road, which is really common if you have surgery. A lot of patients that do one knee need the second knee done within that year. It's very high percentage, versus with our knee brace, that percentage goes down significantly. So again, without the brace, we're looking at strict rest, medication, PT, and very controlled exercise. With the brace, we can have a little more laxity with that and give them a little more freedom. So again, those are reasons why I would recommend bracing post-op. Thanks and have a great day. Bye.